Welcome, I'm going to talk about electrocardiography. First of all, I want to talk about the definition. Definition: electrocardiography is a test based on the interpretation of the electrical activity of the heart. In this image, we can see all the parts of the electrocardiography. First of all, we have the P wave, that is the activation of the atrium. I mean the contraction of the atrium. Another is the QRS complex that concur with the activation of the ventricle. The T wave is the recovery wave or repolarization. In the right part of the picture we have a normal heartbeat. Below this a fast heartbeat, and we can see the minimum space between complex QRS. Another is a slow heartbeat. We have an increase in the space in the squares of the electrocardiograph and irregular heartbeat. And well, in this video is gonna about electrocardiograph.
The heart is a beating muscle that pumps oxygen and nutrient-rich blood throughout the body. Each beat is stimulated by electrical signals that pass through the heart muscle or myocardium. In order to examine the function of the heart, a doctor may perform a test called an electrocardiogram or ECG, also referred to as an EKG. During this test, electrodes are placed on the chest and recordings are then made of the heart's electrical signals. Sometimes the electrodes are also placed on the arms and legs. The electrical signals follow a set pathway through the heart, beginning at a spot called the SA node, which is located in the top right chamber or atrium. The signal then branches out from both the right and left atria, which contract and push blood into the lower chambers or ventricles. The electrical signal also passes into the ventricles via the AV node, and then travels down the tissue that separates these two lower chambers. Finally, the signal travels back up the ventricles, which contract and pump blood to the lungs and body. Variations from the normal electrical pattern may indicate damage to the heart due to a heart attack or heart disease. Often, a patient will be required to perform a stress test during an ECG. A stress test usually involves walking or running on a treadmill at progressively increasing intensity while recording an ECG. This test allows the doctor to examine the heart's electrical activity during the stress of exercise.
Now, continuing with the performance, I'm going to talk about the applications in medicine. First of all, we have a correct function of the heart. Second, detecting of anomaly from function, detecting of coronary blockage arterial, detecting of electrolytic change, show physical condition of the patient in stress, physical condition of the heart, like hypertrophy. Second, we have another video that explains in a simple way
the heart's conduction system controls the generation and propagation of electrical signals, or action potentials, that cause the heart's muscles to contract and the heart to pump blood. This electrical activity can be measured at electrodes placed at specific points on the skin, from which a composite recording is produced in the form of a graph. This recording is known as an electrocardiogram, or ECG, sometimes referred to as an EKG, a tracing of the overall electrical activity of the heart, resulting from the propagation of many action potentials. Let's look at what happens during a single beat of the heart, and how these events are depicted.
We can see more in my presentation in present. Application in Ecuador. It's almost used in every part of Ecuador, principally in determination of physical state of the heart, combined with physical exercise known as ergometry. In this video,
EKG stands for electrocardiogram. It's also known as EKG, and it's a simple, again, painless test that's done using
it's the opinion of an expert that he knows more about electrocardiography. This is the last video.
also called an electrocardiogram, is a test used to measure the normal electrical signals of the heart. First, small electrode stickers are placed on the arms, legs, and chest in a specific location as seen here. Once the electrode stickers have been affixed to the patient, then cables are attached to these electrodes that connect the patient to the EKG machine. For some patients, we may have child life assist by playing with the child to distract them and allow the cables to be more easily placed. The EKG machine only reads signals. It does not cause any discomfort to the patient.
In this video, we could see the correct position of the electrode in the electrocardiography. Thank you.